Hi, my name is Jamie, and I am a student at Indiana State University in the LPN to BSN program, and today I'm here to present to you Alzheimer's disease. Before we start, there's a couple links below. One is for a pre and post test. Go ahead and take that pre-test before starting the rest of the slideshow, and then take it again at the end to see if you've learned anything. There's also a brochure below that is free to print and pass out to those that you want to. Our objectives today would be to be able to name 2 symptoms of Alzheimer's, name 3 ways to cope as a caregiver, and name 4 triggers for behavior issues of Alzheimer's patients. My population at risk today are those that are 65 and older. It is rare for it to be diagnosed at an earlier age. What is Alzheimer's? According to Alzheimer's Association, Alzheimer's is the most common form of dementia and is a degenerative brain disease that describes a collection of symptoms. And we'll learn about what those symptoms are in just a moment. The causes and risk factors for Alzheimer's are genetics, lifestyle, environmental, age, and a family history. They're not exactly sure and can't pinpoint the environmental and lifestyle changes. Age is definitely a factor. It's usually diagnosed at age 63 or older, and those with family members with Alzheimer's are usually more prone to get it than those that are not. Some myths about Alzheimer's is aluminum causes it. So drinking out of soda cans that are aluminum or using deodorant that has aluminum in it causes Alzheimer's. That has not been proven. It's just part of aging. That is also not true. There's many people that are older that do not have Alzheimer's. It's not fatal. That is also not true. Eventually, anybody with Alzheimer's is going to die. It's probably earlier than if they would not have had Alzheimer's. And you get to the point where you are forgetting to eat and drink and you don't know those needs and your body just kind of starts to shut down. It's only an older people disease. That is also not true. In fact, there are some that are in their 40s that have been diagnosed with early onset Alzheimer's. Eating or drinking items with aspartame in it causes Alzheimer's. That is also not a proven fact. Getting your flu shot causes Alzheimer's. If that was true, we'd have millions of Americans, young and old, that have Alzheimer's. Having silver dental fillings, that is also not true. And that there are treatments and cures for Alzheimer's. There are no cure for Alzheimer's. Some facts would be more than 5 million Americans have been diagnosed. It's the 6th leading cause of death in the United States, and 2 out of 3 women are affected by it. Symptoms of Alzheimer's are memory loss that disrupts daily life. And we're not talking about walking down the hallway and forgetting what you were going to do. We're talking about missing appointments, not being able to do a daily task that you do every day, such as loading the dishwasher, or forgetting when you're driving down the road, how to get to the store that you've always gone to. Those are memory loss that have disrupted daily life. Familiar tasks that are difficult to complete, like I said, emptying the dishwasher, putting laundry away, running the dishwasher, starting a coffee maker, items like that. General confusion, trouble understanding spatial relationships or visual images, trouble finding words, trouble problem solving, and mood and personality changes. A lot of people think that by doing crossword puzzles or word finds or other things that challenge your brain help prevent Alzheimer's. And it may help your memory, but it's not proven to actually prevent Alzheimer's. Here's your brain Alzheimer's versus dementia. Alzheimer's is a specific brain disease that accounts for 60 to 80% of the dementia cases. And the other is dementia is just a general term for symptoms like a decline in memory, reasoning, or other thinking skills. So dementia is more of a broad term where Alzheimer's is more honed in. There are some medications that can help slow the progression or symptoms of Alzheimer's. They have very few side effects. They prevent the breakdown of acetylcholine. The most common is Aricept or Donzapril, and it is able to be used in all 3 stages of Alzheimer's. There's a couple other medications. Exelon is used in mild to moderate, and the galantamine is mild to moderate. These are used to help treat judgment, language, and thought process and the thinking. And then you have Namenda and Nemzacric. It's used to treat moderate to severe stages. They can be combined with the other medications, and it's used to improve simple task reasoning and language and memory. Some behavior changes in Alzheimer's. The early stages, you might find irritability, anxiety, or depression, and those are all kind of because they realize that they're not able to complete the tasks that they need to. They're not quite sure what's going on, so they get frustrated easily. Some of the later stages, people get angry or have aggression. There's a lot of anxiety, agitation, some emotional distress because they don't understand what's going on. They can have physical and verbal outbursts. There's restlessness. You see a lot of Alzheimer's patients that pace or walk in circles. They can have hallucinations or delusions. They see people, they hear things. There's sleeping issues, and then sundowning. Sundowning is something that when the sun is starting to set, there's an increase in forgetfulness or not knowing where they're at or confusion. A lot of patients and people have it when they are put into the hospital or at home even. Once the sun starts to set, there's something that triggers them to have some confusion. Other triggers can be moving or traveling. That's changes to the familiar environment can cause them to have some behavior changes. Being asked to do a simple task that maybe they forget how to do it, then they get angry that you're asking them to do something. Infections can cause behavior issues such as a urinary tract infection or maybe even pneumonia. They don't know how to get it across to you that they have something going on. They could be having pain or discomfort and not know how to relay that to their family member or caregiver. A full bladder even. They forget how to go to the bathroom, so they forget to ask to go to the bathroom. Or they could just be really tired. Ways to cope or to keep a calm environment, rest between stimulating activities, having security objects or known familiar objects around, acknowledging that they are forgetful and acknowledge that they're present, investigate and explore what might be causing the problems. Don't take things or comments personally when they have outbursts at you. And then sometimes medications such as Ativan or Haldol to help calm them down when it's gotten to the point where they can't calm themselves down. There's some coping for caregivers as well because it can be a tiring job. Reach out to support groups, talk about different ways to cope with each other and learn different strategies on how to help each other. Learn about the disease and what it's happening. Take your time for yourself. Make your home safe so that you don't have to worry about them all the time. Put alarms on doors, make child-proof cabinets, that type of thing. And know when it's time to transition to a memory care unit where they can be safe all the time, not harm themselves at home. Here are some references and resources that you can reach out to. Thank you for your time.